Hi everyone, Dr. David Keller here with Synergy Wellness in New York. We have a long-term patient here, Gene, who has a rod in his spine and he receives chiropractic care. So some of you may be saying, well, I've had surgery on my back. Is it safe to do chiropractic? Yes, of course. The technique matters though in this situation. He has a rod from T12, the lowest thoracic vertebra, to L4. You can see the scar right down to the lower back. So he has lower back pain, glute pain. So we're able to do some soft tissue work on the glute. We're able to do some Cox flexion distraction technique on his lower back, but only for segments L4 and below, right? L5, lumbosacral joint, L5, S1, because of the rod in the spine. And then the mid back, upper back, we're able to adjust. But, we see him every couple of months when he has an issue, right? You've been doing pretty well?
Yes, sir. Very well.
Yeah, I do. I see him about 6 times a year, I would say.
Yeah.
Okay, he's a Medicare patient, right? So, sorry, I gave up your age just now, almost. But, you can certainly, if you have Medicare, not Medicaid, you can get chiropractic care. It's covered. Medicaid does not cover chiropractic as far as I know. So, we're going to do some flexion distraction technique on the lower back, and then we switch up the technique a little bit on the upper back. So I'll show you how we do Cox technique. And there are a lot of doctors with Cox tables but don't know what they're doing with the technique. And with him, you need to know what you're doing here, especially in post-surgical cases. We treat people with Harrington rods. Those are typically used for scoliosis. He had a really bad fall. He was working at RDU Airport in North Carolina, and they didn't have any safety mechanisms for in case you fell. And he fell about 7 or 8 feet and severely damaged his spine, and we'll leave it at that, okay? And so another application that would be really helpful for him, if chiropractic no longer worked for him, God forbid, right, would be cold laser therapy. And if you're somebody that has the means to do cold laser therapy and chiropractic, specifically Cox flexion distraction technique, then really worth your while. And even trying that before you get surgery, if possible. In some cases you just need surgery. In his situation, he just needed surgery. There was no way to avoid that. But that being said, this is just showing you a little bit of Cox technique. There's different steps in the technique that will take them through doing different motions with the lower spine. And if you've had back surgery or you're considering back surgery, I highly recommend you reconsider Cox technique. You can have it done for your neck and your lower back with cold laser therapy. Hope that helps. If you have any questions or comments, comment below. And don't forget to hit that thumbs up button. Thanks, appreciate you.